Hello and welcome. Today we are diving deep into a really important topic, postpartum depression. It's something that affects so many people, but there's still a lot of misunderstanding around it. We're going to break it all down using insights from reproductive psychiatrist Dr. Crystal Clark to really get a handle on what it is, what causes it, and most importantly, how to treat it. Let's get right into it.
First, I want to start with a number that really puts this all into perspective. 1 in 5. That's how many new parents will experience a perinatal mood or anxiety disorder. Just let that sink in. If you think about 5 friends or family members who've recently had a baby, well, statistically, one of them has likely struggled with this. It is so much more common than we think.
So, to really understand what's going on, we have to start with the absolute basics. What exactly is postpartum depression, or PPD as you'll hear it called?
Okay, so PPD is officially defined as a major depressive episode that happens after giving birth. But here's a super important detail about the timing. The official diagnostic manuals often say it happens within the first 4 weeks, but experts like Dr. Clark are very clear that PPD can actually start any time within that entire first year. That's a huge window.
So what does it actually feel like? We are talking about so much more than just feeling a bit down. It's a sadness that just won't lift. It's losing interest in the things that used to bring you joy. It's major problems with sleep or appetite, and this deep, draining fatigue that just doesn't go away. Clinically, the diagnosis usually requires having 5 or more of these symptoms for more than 2 weeks straight.
Now, this brings us to a really common point of confusion. A lot of people have heard of the baby blues, but how is that different from actual PPD? And then, where does anxiety fit into this picture? Telling these things apart is absolutely crucial for making sure people get the right kind of support. Let's break it down. The baby blues usually kick in right after delivery and they're temporary. They don't last more than 2 weeks. Think mood swings, crying spells. It's a lot, but it passes. PPD, on the other hand, can start anytime in that first year, and its symptoms are way more persistent and severe. So, the key takeaway here, the blues are temporary and common, while PPD is a real, treatable medical condition.
And it's so important to know that it's not always about sadness. Postpartum anxiety is just as common as PPD. Yep, it also affects about 1 in 5 new parents. This is more about excessive, nonstop worry, feeling totally overwhelmed, irritable, and on edge. You do not have to feel sad to be struggling and need support.
Okay, so that's the what. Let's shift gears and talk about the why. What's actually causing PPD, and are some people more at risk than others? Well, while there isn't one single definitive cause, the leading theory points a finger straight at hormones. During pregnancy, hormones like estradiol and progesterone are at an all-time high. Then, after birth, they just fall off a cliff. It's this massive, sudden drop, and it's thought that for some people, the brain has an unusually sensitive reaction to that abrupt withdrawal.
But that hormonal crash happens to everyone who gives birth. So why are some people more vulnerable? Well, there are a few things that can increase the risk, but one of the absolute strongest predictors is a personal history of mental illness, like having dealt with depression or anxiety even before the pregnancy.
But, and this is so important to hear, risk factors do not tell the whole story. Dr. Crystal Clark puts it perfectly right here. All women and birthing persons are at risk for this illness. It doesn't matter what your background is, how much money you have, none of it. This can affect anyone.
Okay, now let's turn to what is truly the most important part of this conversation, recovery. Because no matter how challenging and overwhelming this condition is, there is absolutely hope. There is effective help available.
And the very first number I want you to see in this section is an incredibly encouraging one. With treatment, 80% of individuals recover fully from postpartum depression. Recovery isn't just possible, it's the most likely outcome when you get help.
So, what does that treatment actually look like? Well, it's definitely not a one-size-fits-all approach. For many people, talk therapy is a really effective first step. For more moderate to severe symptoms, medication like antidepressants can be a game-changing tool. And beyond that, there are other supports, like specialized light therapy or even just exercise, that can make a huge difference.
And the impact of getting treatment goes way beyond the parent. When a maternal mental illness goes untreated, it can affect a child's development down the road, socially, cognitively, emotionally. So getting help isn't just for you. It's one of the best things you can do for your baby, too.
So where can you go to get help? The good news is there are some fantastic resources out there. Postpartum Support International is an amazing starting point for finding information and local providers. And for immediate, confidential support, the National Maternal Mental Health Hotline is always there, ready to help.
Which brings us to our final thought. Postpartum depression is not a character flaw. It is not a sign of weakness. It is a treatable medical complication of childbirth. And so the real question for all of us is, knowing this, how can we better show up for the new parents in our communities? How can we make sure they know, without a doubt, that they are not alone?